Watch this hand. The cup just fell. Now watch the face. Wait or call. If you said wait and see, this video exists to change your mind. Because what you just watched could be the first 10 seconds of a stroke. Here is what nobody tells you in time. 1 in 4 adults alive today will have a stroke. 1 in 4. And in the United States alone, it happens every 40 seconds. But right at the start, I want to give you the most important number in this entire video because it is the hopeful one. Researchers estimate that somewhere between 4 in 5 and 9 in 10 strokes are preventable. So here is the deal. 16 minutes from now, you will know what a stroke actually is, the 2 types, and the sneaky third one that disappears. You will know a 6-letter test that spots one in seconds. And you will know the exact checklist that puts you on the right side of that statistic. Let us go inside the brain. Quick scale check. Stroke is the second leading cause of death on Earth. Second, claiming 6.5 to 7 million lives a year. And it does not only take lives, it is the #1 cause of serious long-term disability in countries like the United States. Over 90 million people alive right now are living with what a stroke left behind. And this problem is getting loud. In May of 2025, for the first time in history, every nation in the World Health Assembly adopted a resolution dedicated to stroke. One disease. Every nation. A global plan. Also, retire the stereotype now. This is not just an old person's disease. Over half of strokes strike people under 70. And in America, stroke rates in adults under 65 climbed about 15% in a single decade. So pay attention, whatever your age. Your brain is 2% of your body weight. It consumes 20% of your blood supply. Think about that appetite. Picture your brain as a city at night. Millions of lights, all running, and the city stores almost no fuel. Not enough to matter. Every second of every day, delivery trucks bring in oxygen and energy. The trucks are your blood. The roads are your arteries. A stroke is when the trucks stop coming. But they can stop 2 completely different ways, and that is why there are 2 main types of stroke. Type 1, the roadblock. A clot or fatty buildup seals the artery. Downstream, the neighborhood goes dark. This is an ischemic stroke, and in clinical data, it is the overwhelming majority, roughly 9 out of 10 strokes. Type 2, the burst pipe. The vessel itself ruptures. Blood spills out, flooding and starving the tissue it is supposed to feed. That is a hemorrhagic stroke. Rarer, but deadlier, case for case. Bleeding inside the brain claims almost 3 million lives a year worldwide. And there's a smaller subtype, bleeding around the brain, with about 1.2 million new cases annually. 2 opposite failures, blocked, burst. And here's the unsettling part. From outside the skull, they look identical. Same drooping face, same slurred words. You cannot tell them apart at home. Even in the emergency room, it takes a brain scan. Quick quiz. What is the single biggest driver of stroke on the planet? Smoking? Stress? A bad diet? None of them. It is something most people who have it cannot even feel. I will prove it in a few minutes. Hold that. First, the roadblock. How does an artery feeding your brain get sealed? 2 routes. Route 1, built on site. Over years, cholesterol plaque grows inside the artery wall, a process called atherosclerosis. High blood pressure, smoking, diabetes, bad cholesterol, they all accelerated. One day, the plaque cracks. A clot forms right there, and the road is closed. Route 2, shipped in. And this is one of the strangest facts in all of medicine. The clot that attacks your brain does not have to start anywhere near your brain. It can be born in your heart. There's a heart rhythm condition called atrial fibrillation, AFib. Instead of beating cleanly, the heart's upper chambers quiver. Blood pools, swirls, clots form inside the heart. Then one breaks loose, rides the bloodstream up through the neck, and lodges in the brain. AFib multiplies stroke risk by about 5, and roughly 1 in 4 stroke patients turns out to have it. So the brain did not have a traffic problem. The heart mailed it one. Now the burst pipe. What makes a vessel rupture? Pressure. Uncontrolled high blood pressure hammering artery walls for years until one gives out. Then add aneurysms, thin balloon spots in a vessel wall, blood vessel tangles some people are born with, blood thinning medication, head trauma. One important side note, because it protects people in both directions. Blood thinners can raise bleeding risk, but for people with AFib, they prevent the clotting kind of stroke. Never start or stop one on your own. That decision belongs to a clinician who knows your numbers. But notice something about both lists. Roadblock, burst pipe, the same name sits at the top. Blood pressure. Remember the quiz? We are almost there. So far, 2 types, blocked or burst. Both do damage within minutes. Now for the third one, the one that vanishes.
Breakfast, Tuesday morning. Your father's smile looks crooked. His arm will not lift. His words come out wrong. And then, 20 minutes later, he is completely fine, laughing at himself. False alarm, he says. He is even a little embarrassed. What he just had is called a transient ischemic attack, a TIA. A clot blocked blood to part of his brain, the same roadblock as a full stroke, but it dissolved before permanent damage set in. Symptoms? Gone. City lights? Back on. And here is the trap that costs people their futures. Because he seems fine, everybody relaxes. They call it a mini stroke, which neurologists hate because mini sounds like minor. Many specialists now call it exactly what it is, a warning stroke. Listen to this number. Of people who have a TIA and do not get treatment, more than 1 in 3 will go on to have a major stroke. And a huge share of that danger lands within days. Not years. Days. And you cannot tell the difference at home. While it is happening, a TIA and a stroke look exactly the same. You only learn which one it was afterward, from doctors, after scans. So the rule is simple, and it never bends. If it looks like a stroke, it is a stroke. Symptoms that disappear are not an all clear. They are the smoke alarm doing its job. Call anyway.
So what does looks like a stroke actually mean? 90 seconds. This is the part of the video worth a screenshot. Emergency medicine boiled it down to an acronym. The classic was FAST. The updated version, the one stroke centers now teach, is BEFAST. Walk through it with me, out loud if you can. B. Balance. Did they suddenly lose balance or coordination? Staggering, dizzy, veering? E. Eyes. Sudden vision trouble? Blurred, doubled, or gone in one eye? F. Face. Ask them to smile. Does one side droop? Is the smile crooked? A. Arms. Both arms up, palms up like holding 2 pizza boxes. Does one drift down? S. Speech. A simple sentence. The sky is blue today. Is it slurred, garbled? Can they understand you? T. Time. Any one of these. Call an ambulance. Immediately. And do 2 more things. Note the time symptoms started. Or if you do not know, the last time they were seen normal. Doctors call that last known well, and it decides which treatments are even possible. And one rule that surprises people. Do not drive them to the hospital yourself. Call the ambulance. Paramedics start care on the way, and phone ahead so the stroke team is standing at the door when you arrive, instead of starting from 0.
Notice the word underneath every letter? Sudden.
That is the fingerprint of stroke. Neurologists say about 9 out of 10 strokes are maximally severe the instant they start. No warm-up, no gradual fade, a light switch. It hits in seconds. But here is what most people get wrong about how it feels. Most strokes cause no pain at all. No headache, nothing. So do not wait for one. Sudden numbness on one side, sudden confusion, a sudden worst headache of your life with no cause, those are all on the list. But pain is optional. Urgency is not. In stroke care, we have a mantra. Time is brain.
The sooner a patient gets treatment, the better they do. Every minute genuinely matters. Now let me show you what every minute costs, because researchers actually put a number on it. In the most common severe type, a large vessel ischemic stroke left untreated, the brain loses an estimated 1.9 million neurons every minute, 14 billion synapses, 12 kilometers of nerve fiber per minute. Run the math on delay. One untreated hour is estimated to age the brain about 3.6 years. That let us see how he feels after a nap? It can cost a lifetime. And the treatments are real, but they are on timers. Clot-dissolving medication works within roughly 3 to 4.5 hours of symptom start. For selected patients, surgeons can thread a device into the artery and physically pull the clot out, sometimes up to 24 hours. Both clocks start at the first symptom. Not at diagnosis, not at the hospital door, at the first symptom. That is why the person who saves a stroke patient is almost never a neurologist. It is whoever was in the room. Okay, deep breath. Everything so far has been the frightening half. Now, the half that should change how you live. One of the biggest studies in stroke science, Interstroke, published in The Lancet, spanning 32 countries, found that 10 modifiable risk factors together account for about 90% of all strokes. Every region, men and women, young and old. The Heart Association's estimate is a bit more conservative, around 80% preventable. Either way, the answer is the same. Most strokes are not fate. Now the quiz answer. Which factor is number 1? In that study, high blood pressure carried the largest share of risk of any single factor. Separate analyses find it implicated in the strokes of roughly 3 out of 4 patients, and by some measures, flagged in up to 9 out of 10. And one estimate says up to 40% of all strokes could be prevented by blood pressure control alone. Here is the sinister part. High blood pressure almost never announces itself. No pain, no warning. You can feel like an athlete while it quietly hammers your arteries for a decade. That is why they call it the silent threat. Not because it is rare, because it is invisible until it is loud. And the only way to know is to check. The rest of the hit list. Fast. Smoking. It chemically wounds vessel walls. Diabetes. High blood sugar scours arteries. And long-standing diabetes roughly triples stroke risk. LDL cholesterol. The raw material of plaque. Inactivity and excess weight. They feed pressure, sugar, and cholesterol at once. Salt-heavy, ultra-processed diets. Sodium pushes pressure straight up. Heavy drinking. Same pipeline. Chronic stress and depression. Real, measurable contributors. And the heart. Especially AFib, the clot factory we met earlier. Flip that list, and it is a playbook. Check your blood pressure regularly. And if it is high, take prescribed medication consistently, because most danger comes when treatment lapses. Do not smoke. Quitting starts healing vessels fast. Manage sugar and know your cholesterol. Move. Walking counts. Consistency beats intensity. Eat more vegetables, fruit, whole grains, beans, and pull salt down. Drink less. Treat your heart. An AFib diagnosis, managed properly, is one of the biggest stroke prevention wins a doctor can hand you. 16 minutes. 4 words. Check. Blood pressure, blood sugar, cholesterol. The most dangerous risks are the silent ones, so measure, do not guess. Control. Pressure, sugar, plaque, heart rhythm. Treat them like what they are, emergencies moving in slow motion. Recognize. Balance, eyes, face, arms, speech. Sudden, one-sided, out of nowhere. And do not wait for pain, because it usually is not coming. Act. Ambulance first. Note the time. Never wait and see. Remember the man at breakfast. Every minute of waiting costs about 1.9 million neurons. So one last time. The cup falls, the smile is crooked, the words come out wrong. Do you wait, or do you call? Now you know. And 1 in 4 of us is going to need somebody who knows. Here is the only thing I am asking. Say the letters out loud with me one more time. Balance. Eyes. Face. Arms. Speech. Time. And then send this video to one person whose blood pressure has not been checked in years. Not to scare them, because the day it matters, nobody has time to Google it. If evidence-based health in plain language is your thing, subscribe. Your blood pressure will thank you. Stay safe.